If you're over 50, especially if you're in your 60s, 70s, or beyond, and you wake up with that deep, nagging shoulder ache after sleeping on your side, I want you to listen closely. It can make getting dressed harder. It can make reaching into a cabinet feel sharp and unpleasant. And it can even make you dread bedtime. Today, I'm going to share a simple, senior-friendly routine you can do in just a few minutes that may help calm down side sleeping shoulder discomfort and help you set up your sleep position so you're not irritating the shoulder all night long. We'll go step by step, and I'll give you easier options if you need them. Hello, my friend, and welcome back. I'm Dr. Sarah Truman. I'm a health coach and wellness educator specializing in senior health and active aging, and I'm really glad you're here. Now, I want to say this clearly. I'm a health educator, not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before starting any new exercise, changing your diet, or trying any supplement, especially if you have any health conditions or take medications. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. Now, in this video, we're focusing on a very common issue: shoulder pain or shoulder stiffness that seems to show up or get worse when you sleep on your side. A lot of people tell me, "Sarah, I fall asleep fine, but I wake up and my shoulder feels jammed, sore, or tight." Or they say, "I can't sleep on my back, so I'm stuck on my side, but my shoulder pays the price." Here's what we'll cover today. First, I'll explain why side sleeping can irritate the shoulder as we get older, in plain language. Then we'll go through a simple sleep setup that can take pressure off the shoulder. After that, I'll teach you a gentle, quick relief routine you can do before bed and even during the night if you wake up sore. Then we'll do a short morning reset to help you start the day looser and more comfortable. And finally, we'll talk about common myths and mistakes, plus the red flags that mean it's time to get medical help. If that sounds helpful, let's begin. Let's talk about why this matters and why it's so common after 50. Your shoulder is a very mobile joint. That's a blessing because it lets you reach, lift, wash your hair, and do everyday tasks. But it's also a little bit of a challenge because mobility often comes with less built-in stability. The shoulder depends a lot on smaller muscles, tendons, and good positioning to stay comfortable. When you sleep on your side, your shoulder can get squeezed between your body and the mattress. It's like having a door hinge with pressure on it for hours. Over time, that pressure can irritate the tissues around the joint. Some people may feel it in the front of the shoulder, some on the outside, and some deep inside. And when we're older, those tissues can be a bit more sensitive. That doesn't mean anything is broken. It just means your body may need more gentle support. Another common piece of the puzzle is posture during the day. Many of us spend time with our shoulders slightly rounded forward. Think of reading, looking down at a phone, driving, or sitting at a table. When the shoulders round forward, the shoulder blade can sit in a less helpful position. Then at night, when you lie on your side, that rounded position can make the shoulder feel even more pinched or cramped. Pillow height also matters more than people realize. If your pillow is too high or too low, your neck tilts. And when your neck tilts, your shoulder often hikes up toward your ear without you noticing. Now you're compressing and tensing the whole area for hours. That can lead to morning stiffness that feels like shoulder pain, even when the neck is contributing. And the last big factor is something simple. We don't move much while we sleep. During the day, you shift, you adjust, you swing your arms, you change position. At night, you might stay in one position for a long time. That prolonged pressure plus less movement can lead to stiffness, swelling, or irritation. This is very common. You're not weak. You're not doing anything wrong. The good news is, small changes in how you set up your side sleeping, plus a few gentle movements, can often make a noticeable difference in comfort. Before we move on, I'd love to hear from you. Is your shoulder pain worse when you sleep on the right side, the left side, or both? Tell me in the comments. And if you're not sure where to start, just type side sleeper, and I'll know you're here with me. Now let's get into the first thing that may help, and it's the fastest win for many people: changing your side sleep setup to reduce pressure on the shoulder. Not by forcing yourself to sleep on your back, if you hate that, but by making side sleeping kinder to your shoulder. Here are the steps. First, choose which side to sleep on. If one shoulder is clearly more painful, many people find it more comfortable to sleep on the other side for a while. If you do that, we're simply giving the irritated side a break. Now, if you can't avoid sleeping on the sore side, don't worry. We'll talk about a setup that may help reduce compression. Second step, hug a pillow. I know it sounds almost too simple, but when you hug a pillow, your top shoulder and arm have somewhere to rest. Without a pillow, the top arm often falls forward and pulls the shoulder into an awkward twist. Over time, that twisting can irritate the shoulder and upper back. So place a pillow in front of your chest and let your top arm rest on it. Your elbow can be bent, relaxed. Think soft, think supported. Third step, support the armpit area of the bottom shoulder. This is a game changer for many side sleepers. Take a small towel, roll it up like a little sausage, and place it under the armpit of the bottom arm, not directly under the shoulder joint itself. You're not trying to jam the shoulder up. You're simply filling the gap so the shoulder isn't collapsing inward toward the mattress. If you don't like a towel roll, you can use a small cushion or a folded t-shirt. The goal is gentle support, not pressure. Fourth step, check your neck pillow height. When you're on your side, your pillow should fill the space between your head and the mattress so your neck stays in a neutral line, not bent down toward the mattress, not tilted up toward the ceiling. If your pillow is too tall, your neck bends away from the mattress and your shoulder may creep up. If it's too flat, your neck bends down and can strain the upper shoulder. You can experiment by adding or removing a little height. Some people fold a small towel inside their pillowcase for a tiny lift. Fifth step, put a pillow between your knees. This isn't directly about the shoulder, but it helps align the spine. When the spine is more comfortable, your upper body often relaxes more, and that can reduce nighttime bracing in the shoulder and neck. Now, safety notes. If you have severe osteoporosis, a recent shoulder injury, recent surgery, or a condition where your doctor has given you specific sleeping restrictions, please follow their guidance first. And if any pillow position makes your shoulder feel more numb, tingly, or sharply painful, stop and adjust. Comfort is the goal. I want you to think of this as a pressure management strategy. Less pressure for hours means less irritation, and sometimes that alone changes everything. Now that we've covered the sleep setup, let's move to something that can help in the moment, especially if your shoulder feels cranky right before bed. This is a gentle relief routine that takes just a few minutes. It's not intense. It's not about pushing through pain. It's about inviting the shoulder to settle down. The first part is shoulder blade setting. Your shoulder blade is like the foundation. When it's in a steadier position, the shoulder joint often feels safer. Here are the steps. First, sit comfortably on the edge of your bed or in a sturdy chair with your feet on the floor. Let your arms rest by your sides. Take a slow breath in through your nose. Then as you breathe out, gently pull your shoulder blades back and slightly down like you're trying to tuck them into your back pockets. Not hard, not a military posture, just a gentle set. Hold for about 3 seconds, then fully relax. Repeat that 5 times. If you notice your shoulders creeping up toward your ears, that's your reminder to make it smaller. The movement is back and down, not up. The second part is a gentle pendulum. This is a classic soothing movement for a tender shoulder, and it's very mild when done correctly. Step 1, stand near your bed or a counter and place your non-painful hand on it for support, so you're stable. Step 2, let the painful arm hang down like a heavy rope. Keep the elbow soft, not locked. Step 3, use a tiny shift of your body to let that arm swing gently forward and back like a pendulum clock. Just a small swing. Do this for about 20 to 30 seconds, then switch to a gentle side-to-side swing for another 20 to 30 seconds. If it feels okay, you can make small circles like the size of a saucer for about 10 seconds in each direction. Important safety note. The shoulder should feel like it's being washed with movement, not forced. If you feel sharp pain, pinching, or catching, stop immediately. Make the movement smaller or skip this part and just do the shoulder blade setting. The third part is a gentle chest opener because many side sleepers and many of us who sit a lot have tightness across the front of the chest that pulls the shoulder forward. Here's an easy version. Sit or stand tall. Place your hands behind your back only if it's comfortable. If that's not comfortable, keep your hands at your sides. Now lift your breastbone slightly, like you're proudly wearing a necklace. And gently roll your shoulders back once. Again, not forced. Hold for one slow breath. Then relax. Repeat 3 times. If you want an even simpler option, just place one hand on your chest and take 3 slow breaths, letting the front of the shoulders soften on the exhale. Now, a quick comfort option many people like before bed is warmth. A warm shower or a warm compress can help muscles relax. Please be careful with temperature, especially if you have reduced sensation in your skin. And if you have swelling or inflammation that feels hot to the touch, some people prefer cool instead of warm. If you're unsure what's best for your situation, ask your healthcare provider. Pause the video here if you want to try that quick routine now. Shoulder blade set, gentle pendulum, and a small chest opener. It's a few minutes, but for many people, it changes how the shoulder feels going into the night. Now let's move on to the third key habit, and this one is specifically for those moments when you wake up in the middle of the night with shoulder pain, or you wake up in the morning and your shoulder feels stiff and stuck. This is a tiny reset that you can do without turning it into a whole workout. First, when you wake up sore, resist the urge to immediately stretch aggressively or yank the arm overhead. I know the instinct is to pull it loose, but with shoulders, too much too fast can irritate things more. Instead, try this gentle 3-step reset. Step 1, do a neck check. Simply roll your head very slightly side to side, like you're saying a small no, staying in a comfortable range. Then bring your head back to center. This helps because sometimes the neck and upper shoulder muscles tighten during side sleeping. Step 2, do a shoulder roll, but make it tiny. Lift your shoulders a little, roll them back, and let them drop. Do that 3 times. If rolling bothers your shoulder, skip it and do a simple shrug and release instead. Step 3, do a supported arm slide. This is very gentle. Sit up in bed or sit at the edge of the bed. Keep your elbow bent at about 90 degrees. Now, keeping your elbow close to your side, slowly slide your forearm outward and back inward, like a windshield wiper. Only as far as comfortable. Do 5 slow repetitions. Why this helps is simple. This movement can lubricate the joint a little. Lubricate is just a friendly word for help it glide. When joints stay still for hours, they can feel stiff. Gentle motion reminds the tissues that it's safe to move. Now here's a modification if you have pain with that motion. You can do the same windshield wiper movement with your hand resting on your belly, so you're not lifting the arm at all. Or you can skip it and just do shoulder blade setting again, those gentle back and down squeezes. And here's another option many people find comforting. Use a pillow under the forearm on the painful side when you're sitting up. When the arm is supported, the shoulder muscles don't have to hold the weight of your arm. That alone can reduce discomfort. Now let's talk about what to do in the morning because this is where many people get discouraged. You wake up, you try to put on a shirt, and the shoulder complains. The goal in the morning is not to test your range right away. It's to warm the shoulder up gently and get the shoulder blade moving. Here's a simple morning reset that takes about 2 to 3 minutes. First, start with warm hands. Rub your hands together for 10 seconds and place your warm palm over the front of the shoulder or the side of the shoulder, wherever it feels sore. Just gentle contact. Take 1 slow breath. This can help your nervous system relax, which matters because pain is not just tissues, it's also your nervous system being protective. Second, do a wall-supported shoulder blade slide. Stand facing a wall. Place both hands on the wall at about chest height. Keep your elbows soft. Now, without bending your elbows much, gently slide your shoulder blades forward, like you're letting your chest move slightly toward the wall. Then slide your shoulder blades back like you're gently widening your collarbones. This is a small movement. Do 8 slow reps. Think smooth and easy. Third, do an arm paintbrush movement. Stand or sit tall. Let your arms hang. Now gently swing your arms forward and back, very small, like you're brushing crumbs off your pants. Keep it relaxed. Do that for 20 seconds. Then stop and notice how your shoulders feel. Fourth, do a gentle reach across the body, but only if it's comfortable. Take the painful arm and reach it across your chest like you're giving yourself a half hug. Use the other hand to support the elbow if needed. Hold for 10 to 15 seconds. You should feel a mild stretch in the back of the shoulder. Then, release. Safety notes here are important. If you have a known rotator cuff tear, a history of shoulder dislocations, or a condition like frozen shoulder, which is when the shoulder becomes very stiff over time, please check with your healthcare provider or a physical therapist before trying new stretches. And if any movement causes sharp pain, catching, or a sudden increase in pain, stop right away. Now I want to offer a simple daytime habit that can prevent the shoulder from building up tension again. It's called the 2-sentence posture reset, and you can do it anywhere. First sentence, soften your ribs and breathe out slowly. Second sentence, gently bring your shoulder blades back and down just a little. That's it. Do it a few times throughout the day, especially after using your phone, reading, or driving. These tiny resets help keep the shoulder from living in that rounded, pinched position that can make side sleeping harder. Now let's move to the fourth key point, and this is about long-term support so your shoulder is less irritable at night. Remember, we're not treating a disease here. We're supporting comfort, mobility, and healthy movement patterns. And these habits are gentle and realistic. The first habit is use it, but don't abuse it. Many people do one of two things. They either avoid moving the shoulder because it hurts, or they push it hard because they're afraid of losing mobility. The sweet spot is gentle, regular movement within a comfortable range. A few times a day, do light shoulder blade setting, small arm swings, or the wall-supported slide we did earlier. Consistency matters more than intensity. The second habit is be mindful with reaching and lifting. If reaching overhead hurts, try this. Step closer to what you're reaching for. Use both hands when possible. And avoid lifting heavy objects away from your body with a straight arm, because that puts extra load on the shoulder. This isn't about fear, it's about smart mechanics. The third habit is a simple strength support move that many seniors tolerate well, and it's very gentle. It's called an isometric. That just means you press without moving. Here's how. Stand next to a wall. Bend your elbow to 90 degrees and keep it tucked by your side. Make a loose fist. Now place the outside of your fist against the wall and gently press outward, like you're trying to rotate your hand away from your belly, but the wall stops you. Press at maybe 20 to 30% effort. Very light. Hold for 5 seconds. Relax. Do that 3 times. Then turn around so the inside of your fist is against the wall and gently press inward as if rotating toward your belly. Hold 5 seconds. Relax. Do 3. This may help wake up the small stabilizing muscles around the shoulder without irritating the joint with lots of movement. But again, if this increases your pain, skip it and ask your healthcare provider what's appropriate for you. The fourth habit is sleep environment. If your mattress is extremely firm, the shoulder can take more pressure. If it's extremely soft, your shoulder can sink in awkwardly. Many people do best with a medium support that keeps the spine aligned. You don't necessarily need a new mattress. Sometimes a mattress topper or adjusting pillow support makes a big difference. And remember that hugging pillow and that little towel roll under the armpit. Those are low-cost changes that can be surprisingly helpful. And lastly, hydration and gentle breathing. I know it sounds unrelated, but when you're dehydrated or stressed, muscles tend to tighten. Before bed, sip water if your doctor has told you it's okay for you, and do 3 slow breaths with long exhales. Longer exhales tell the nervous system, we're safe. A calmer nervous system often means less nighttime clenching in the shoulder and neck. How does this sound so far? If you'd like, tell me in the comments which one you're going to try tonight. The pillow hug, the towel roll, the pendulum, or the morning reset. Now, let's talk about common mistakes and myths, because this is where a lot of frustration comes from. Myth number 1 is, If it hurts, I should stretch it hard to loosen it. I understand why people think that. But with shoulders, aggressive stretching can sometimes irritate the tissues more, especially if there's inflammation, tendon irritation, or joint sensitivity. What we actually know is that gentle, repeated movement in a comfortable range is often better tolerated. So instead of forcing a big stretch, do smaller motions more often. Myth number 2 is the only solution is to stop side sleeping. For some people, back sleeping does reduce shoulder pressure, but many seniors can't sleep comfortably on their back, maybe because of snoring, reflux, back pain, or just habit. The better approach for many side sleepers is to improve alignment and support. Hugging a pillow, supporting the armpit, and keeping the neck neutral can reduce pressure without forcing a sleep position you hate. Myth number 3 is, if I rest it completely, it will go away faster. Rest can help in the short term if something is irritated, but complete avoidance often leads to more stiffness and weaker support muscles over time. The healthier middle ground is relative rest. That means you avoid the movements that clearly flare it up, but you keep the shoulder moving gently in ways that feel safe. And here's one more mistake I see often: ignoring the neck and upper back. Many people chase the shoulder pain directly, but the shoulder doesn't live alone. The neck, upper back, and shoulder blade all work together. That's why we did shoulder blade setting and a little neck checking. Sometimes those simple pieces make the shoulder feel better because you're improving the whole system. Research is still ongoing in this area, and everyone's body is different. What works for one person may not work for another. Results vary depending on your health situation, so be patient with yourself and treat this like a gentle experiment. Try one change for a few nights. Notice what improves, keep what helps, let go of what doesn't. Now, I want to be very clear about when to see a doctor or healthcare provider. While these tips may help many people, please see your doctor right away or seek urgent care if you experience any of the following: chest pain or pressure, especially if it spreads to your shoulder, arm, jaw, or back; sudden shortness of breath; dizziness or fainting; sudden weakness or numbness, especially on one side of the body. Those can be emergency warning signs, and it's important to get immediate medical help. Also, specifically for the shoulder, please get checked if you have severe or unusual pain, pain after a fall or injury, a visible deformity, sudden inability to lift your arm, significant swelling, redness, warmth, fever, or numbness and tingling that doesn't go away. And if shoulder pain is waking you every night for weeks, or it's steadily getting worse, that's a good reason to talk with a professional. Trust your instincts. If something doesn't feel right, it's always better to get it checked. And I'll say it again because it matters. This is for educational purposes only. Please consult your doctor or healthcare provider before starting any new exercise or routine, especially if you have existing shoulder conditions, nerve problems, or you're recovering from surgery. Now, let's quickly recap what we covered today so you can remember it and actually use it. Number 1, we talked about improving your side sleep setup. Hug a pillow to support the top arm. Use a small towel roll under the armpit of the bottom shoulder to reduce that collapsed pressure. And adjust your neck pillow height so your neck stays neutral. Number 2, we did a quick bedtime relief routine. Gentle shoulder blade setting, a very light pendulum movement, and a small chest opener. The goal is calm, not strain. Number 3, we covered a nighttime and morning reset. Tiny neck checks, small shoulder rolls, and a supported arm windshield wiper if comfortable. In the morning, wall-supported shoulder blade slides and small arm swings to get things moving again. Number 4, we talked about long-term support habits. Gentle daily movement, smart reaching and lifting, optional light isometric presses against a wall, and calming the nervous system with breathing and a comfortable sleep environment. Remember, you don't have to do everything at once. Start with one small change that feels manageable. For many people, it's simply hugging a pillow and adding that small towel roll. Then layer in the bedtime routine. Small steps add up over time. Be patient and kind with yourself. Your body is doing its best, and you're giving it support. If you found this helpful, I'd be so grateful if you'd give this video a thumbs up. It helps other seniors find this information too. And if you're not subscribed yet, consider joining our community. I share new videos every week to help you stay strong, healthy, and independent as you age with routines that are simple and realistic at home. And if you'd like to keep going, I recommend watching my next video on gentle neck and upper back stretches for seniors because improving that upper back posture can often support shoulder comfort as well. I'll put the link on screen and in the description. Thank you so much for spending this time with me today. Take care of yourself, sleep as comfortably as you can, and I'll see you in the next video.